This is really important to be able to have this discussion. I'd also like to let you know this webinar will last for about 60 minutes. During the first 30 minutes, we'll be taking a couple of questions to each of the two speakers to introduce the topic and allow them to share their views and reflections. During the second half of the webinar, I will be taking your questions, the questions that many of you sitting in somewhere in the Middle East, Africa, or Far East, and I really welcome the fact that in this morning's webinar we have colleagues from 59 countries live following this conversation. So I really like to encourage you from this very moment not to hesitate to send us questions. If you look on the top right-hand side of your screen, you will see a Q&A box. It's the third button to the right. And I would really want to encourage you to send questions that I will be taking to both speakers to share your challenges and reflections and advice on to tailor-make the response on the ground. The webinar is interactive, like all previous Transformative Agenda webinars. So on the top right-hand screen, you see the chat box, and I really want to encourage you throughout the conversation not to hesitate to also talk to each other, share reflections and good examples or challenges, so that it's really a multi-platform conference room with all of us being able to interact and share on this topic. I'd like also to let you know that this webinar will be recorded and will be available on our website at the end. Also, the same webinar will be repeated on Friday afternoon, 3 p.m. Geneva time. So if you want to encourage any of your colleagues to join, then please go ahead for the Friday afternoon. If you have any problems with the sound, I also want to highlight that on the number 2 point on your screen in front of you, there is a YouTube link, actually the number 3 one, which would allow you to listen with a good quality if you have difficulty with hearing this webinar through the regular internet link. So I'd like us now to move back into the topic. Today's topic is really looking into practical steps to stop sexual exploitation and abuse. Of course, sexual exploitation and abuse of affected people by humanitarian workers is really one of the most biggest and basic failures of accountability to the very people we're trying to work. As the Secretary General of the United Nations has said, the trust that people put in us should never be broke by despicable acts of sexual exploitation and abuse. It is our responsibility to protect all those who we serve. Now, in today's topic of the webinar, what we would like to do is really focus onto the practical steps, the practical actions, the practical coordination or response that each of us, each of you, listening to the field must put in place in order to ensure that the prevention of sexual exploitation and abuse mechanisms are in place. So I will be asking our speakers today to really be practical and to share their reflections as we will be talking on this topic. To answer the questions, I'm really delighted to honored to introduce two distinguished speakers today. And I have to say, here with me in Geneva, I have Ambassador William Swing. Ambassador Swing, he is the Interagency Standing Committee champion on the prevention of sexual exploitation and abuse. And of course, he's the Director General for the International Organization for Migration. Ambassador Swing, you're very welcome to have you with us here. I would also like to introduce Mr. Mohammed Fall, who is the Humanitarian Country Team focal point for the prevention of sexual exploitation and abuse, and is joining us from Bangui, Central African Republic. Mr. Fall is also the UNICEF representative for the Central African Republic, and he's joining us live from CAR. We have decided in today's conversation to look into Central African Republic as one of the countries where there's been some cases reported more among peacekeepers, but also one of the countries where the Humanitarian Country Team, the leadership in country, has taken active steps to ensure the prevention mechanisms are in place. So I'm going to start with the first question, and Ambassador Spring, I'd like to ask you why leadership is important at the field level by the humanitarian coordinators, by the agency reps, by the NGO country directors, in order to prevent, in order to address, in order to respond to sexual exploitation and abuse by humanitarian workers in the field. So if you could tell us your reflections of it.
Thank you very much, and welcome to all of our colleagues and participants. First of all, it's an honor to be with you. I'm delighted for this opportunity. I think we have been, as IOM, a strong supporter of the IASC as a rallying point for the international humanitarian community on this major issue. We see the Interagency Standing Committee as playing a critical role as we fight against sexual exploitation and abuse. I think in many ways it's extremely embarrassing for us all as members of the humanitarian community that to this day we still have not brought under control the whole question of violating a sacred trust that has been given to us by abusing individuals that we're there to care for. The consequences are quite clear. Obviously, the harm to the individual beneficiaries. There is no way to make anyone whole who's been sexually abused and exploited. It jeopardizes our reputation as responsible humanitarians, and it clearly destroys any ability we might have to fulfill our mandate. So it is extremely, extremely critical that those in the humanitarian community, that all of us take this very seriously. The challenges are fairly straightforward. Number one, there is a lack of visible senior management leadership, and I say that advisedly because I'm not meaning to be talking about my own colleagues, but I take this seriously. I haven't done enough. None of us have done enough, and we clearly have to do more. Or we're going to continue to see the same very, very damaging, very embarrassing incidents that we've seen recently at a number of our posts. Secondly, and I hope we can talk about this at Montreux at the retreat that's coming up, the PSEA, or Preventing Sexual Exploitation and Abuse, has not had a clear place within the humanitarian community's architecture, and it needs to be. I looked over the list of all the participants today. All of us should have somewhere in our terms of reference a responsibility for preventing SEA. And we can see on our documented efforts the strides that we have made, but the road ahead is much longer than the road we've taken. There's a persistent and dangerous issue here, and it has not gone away. And I think we've all seen the very recent reports of misconduct. Many cases don't even reach investigation units for a number of reasons. One, of course, the lack of any safe and accessible complaint mechanisms for beneficiaries where they can come forward and tell what's happened to them. Also, there's a perception that perpetrators are unlikely to be punished in any case. There are too many of those who have gone unpunished and often unnoticed. We just done a pilot project in Ethiopia and the DRC with the support of several agencies. In Ethiopia and DRC, we got a total of 281 complaints, 200 in the DRC, 81 in Ethiopia. 43 were SEA allegations against humanitarian staff, 37 in the DRC, and 6 in Ethiopia. So the status quo is simply unacceptable. We need more than just agency condemnation. That's important. But more important is a real change in behavioral attitude on the part of all of our staff. So maybe I could leave it at that for the moment. There's more to be said on this, but I don't want to go on at length. I think I've made my point. Thank you.
Ambassador Swing, thank you for being so blunt. You're describing a situation where there's clearly a lot of catching up that we need to do as a system. The role of senior leadership, the role of all of us, each of us at all levels, to be able really to make sure that there is respect in the relation we have with the people, that it takes place is really crucial. The status quo is unacceptable, as you put it. So let me ask you, so for colleagues who are listening at the field, what are the practical steps or the guidance that exists, that is in place in order to help guide the humanitarian coordinators, the senior leadership, every colleague in the field, to make sure that there are these mechanisms in place? You're clearly saying there is a lot of catching up. What is in place that the colleagues in the field could base themselves in order to indeed ensure that these mechanisms are in place?
Perhaps I should back up and give a little bit of background as to how we got where we are today in terms of trying to create something within the architecture of the humanitarian community that would be helpful. We began in December 2011 at the Interagency Standing Committee meeting, which I was asked to be the so-called champion on PSEA. I recall at the time I said to the other colleagues in the IASC, look, I appreciate the honor and the responsibility you've placed upon my shoulders, but let's be honest, you didn't select me because I succeeded. You selected me because I had failed, right? They were too polite to say yes, but it was true because I had failed, and I had failed miserably in the DRC as the Special Representative Secretary General for the peacekeeping mission, MONUC at the time, because we had had gross abuse of sexual exploitation by both our military, police, and our civilian staff. We almost lost the mission because of the loss of credibility. But we took it in hand. We helped develop a policy for the UN, including all aspects. And since then, we have created a system in which we have now senior focal points in agencies. Each agency developed action plans, and we've recently been working on these two complaint mechanisms in the DRC and Ethiopia that I mentioned. I think the PSA networks are very important, the complaints mechanisms also, and we have to find a way to ensure that survivors have some access to immediate and long-term assistance and to coordinate all of our allegation referrals. The two big weaknesses right now are, number one, we still to this day do not have an adequate policy on compensation for victims, knowing that they can never be fully compensated, but something to give them a sense that justice is being done. That has not happened. Secondly, and this is hard to believe in a period of technological advances we've had, it is still happening that people who have been dismissed from one agency for sexual exploitation and abuse manage to somehow come up again and find their way back into another UN agency. That's simply unacceptable, and that needs to be addressed urgently. So I guess I can maybe leave it at that for the moment. But this has to come down to the ground level where each of us is working, or we will not have a system that is functioning.
Pastor Swing, indeed, first of all, your personal testimony and really taking an issue which was a challenge and turning it into a champion, being the champion for it, is really very inspiring for all of us. But indeed, what you're saying, that this issue has to come down to the field level. And I'd like us actually to take us all to the field, where we're also joined from Bangui by Mr. Mohammed Fall, who is the UNICEF representative in CAR, and also the PSEA focal point of the humanitarian country team. Mohammed, you're very welcome and great to have you with us. let me ask you, the Central African Republic has been a lot in the news, a lot in the media, with cases of abuse, primarily by peacekeepers, but possibly also others. What we're really interested to hear from you is what are the actions that you have taken in the Central African Republic in order really to address the PSEA, also given in particular the integrated nature of the mission, where you know, the humanitarian and the peacekeeping is part all of a broader political humanitarian mission in Central African Republic. So, Mohammed, over to you.
Thank you very much, panel. Allow me, first of all, in a few words, to greet the Ambassador Swing, greet all the participants to this webinar, and thank them for their interest on this important subject, but at the same time for their interest of listening the situation that is prevailing right now in CAR. As you rightly pointed out, we are overwhelmingly placed in the major scrutiny for the large number of cases that we are having, which is very alarming, and I can say even which is very shocking, knowing that most of the cases involve women, involve girls, involve boys also, but involve also underage and children. We are at the same time also very proud to say that given the large number that we are facing here, we have also been taking very bold measures across the board to respond to PSEA. And I can say also that some of the measures that are being undertaken now in CAR are even inspiring the international community in the overall commitment of reinforcing the zero tolerance policy of the UN and the international community with regard to PSEA. Practically, as I say, it is a commitment that has been taken across the board. And I was extremely happy to hear Ambassador Swing highlighting the importance of leadership commitment. And I can see what we have seen today in CAR is a commitment both from the mission, you refer to integrated mission, it's the leadership of the mission that really take the lead and with a kind of very strong drive, very strong commitment into preventing, responding, and coordinating how to address PSEA. The same drive and the same commitment also is taken at the humanitarian country level, with a code of conduct that has been signed by a very large number. I could say even the entire international community present here in CAR, the humanitarian community, has committed to this code of conduct, reminding every single step that needs to be taken within the humanitarian community to prevent and to address PSEA. We have also the same drive within the humanitarian country team, within the UN country team, which gathers mostly the UN organizations, including those that are part of the humanitarian community. Our response, as I say, goes on, first of all, prevention. Prevention both on the side of the potential perpetrator, who are whether the humanitarian workers or the peacekeepers, and prevention also beside next to the potential victims or survivors who mostly and unfortunately belong to the most deprived community. We have also major undertaking in terms of coordination. Coordination in information sharing. Coordination also in bringing response to victims, which is the critical part. Because as we witness, the impact of this PSEA on victims are at all levels. You see them at psychosocial level. You see them at physical level. You see them also at social level, because most of the time they end up being victimized, they end up being stigmatized within their communities, and they end up also being at risk, because also they are not only victims, but in most cases also they are witness at risk. And we need to provide them protection, and it is the area in which we are putting a lot of our attention and a lot of our resources to be able to find an alternative and to put the recovery process for the victims and the survivor of PSEA. Maybe I will keep it there until we have more questions.
Thank you, Mohammed. I see on the screen quite an elaborate three-pillar graphic where for all listeners you see on the left column on the humanitarian side, all the steps that Mohammed was describing with the UN agencies, the resident coordinator, but also within the leadership of the peacekeeping mission and the tasks that are taken going all the way down to the field. We're going to come back more on this, but Mohammed, can I ask you, can you tell us a little bit more about the protection and support that is given to survivors of sexual exploitation and abuse? Our responsibility vis-a-vis them is really crucial. If you can elaborate a little bit further on that, thank you.
Thanks, Panos, for allowing me to come back on this part of our endeavor, which I consider as one of the most important parts, mainly seen from the perspective of the humanitarian communities. The first response we provide is medical support. From the minute we know a case, the first action to be taken in our referral pathway is to refer the victims to a medical structure to make sure of all the impacts that this exploitation or the abuse could have on the health and the well-being of the victims or the survivor. The second dimension is psychosocial, because as we know, most of these SCAs, they leave wounds which are physical, but they leave wounds which are mental also. And we have seen it, for example, by taking some of the victims through specialized or in-depth counseling support or psychosocial support. And when we get feedback from those specialized or the psychologists, we can really have a proper reading of the kind of nightmare or of the kind of wound that these victims face. And I think that the psychosocial aspect is extremely important. We do also a lot of work in terms of reintegration, because as I mentioned earlier, they are not only victims of an abuse, but most of the time also they are victims of stigmatization within their communities. I can't use some of the awful words or some of the awful situations that some of the survivors are facing within their communities, and providing them with support in terms of livelihood, in terms of education reintegration, in terms of activities that keep them away from the nightmare they have gone through is also part of our endeavor. Now we have seen with the commitment of the international communities also, troop contributing countries taking this issue very seriously, sending investigators in country, trying to substantiate the fact for which their elements are accused. And this process also requires a support and a presence of the humanitarian actors in terms of preparing psychologically the victims to be able to respond properly to the question, working at a global level and a country level on an interviewing modality which is friendly and which respects international standards of interviewing a child, of interviewing a woman, of interviewing a victim. We do have also some kind of protections which could take, which could go up to a relocation, because as I was referring to stigmatization, but stigmatization is not the only risk they are facing. They are also facing risk of being threatened, or risk of being pressured, or risk of being bribed by perpetrators. And to avoid this kind of situation, we do also activities that are relocating victims into an area where access or exposure to some of this risk could be limited. We do have also process of legal support, because most of these victims also are mostly illiterate, are mostly coming from poor background, are mostly coming from very vulnerable communities. Facing justice system or facing prosecutor could be something very difficult for them. We work, for example, in the context of Bangui with what we call the Women's Lawyers Association, which could provide legal assistance if required. But the legal assistance goes also to a more larger scale, because what we have witnessed also in the case of CAR, with this number of cases, we are also facing children or cases where, for example, a pregnancy or a birth can occur. And the way we assist also include trying to help victims to have paternity recognition or to have support, not only for the victim, but for the baby that is born from some of these cases. Maybe I will keep it there until later on, or see what are the next questions.
Thank you, Mohammed. What a grim picture, the stigmatization that goes to the victims, to the survivors within the communities. but also the steps you described, the medical, the psychological, psychosocial, their integration, the support, that's really the protection, the legal, all of that is really crucial from colleagues listening from other operations to be able to put mechanisms in place. Colleagues, I want to remind you that it's 30 minutes past the hour, and we really want to be taking your questions. I really want to point out that on the top right-hand side of the screen, there is a Q&A button. So please, I want to encourage you to go ahead and send us questions. We have already received some questions, but really we're keen to make sure we answer to your own question. Also, you see on the screen there is an opening poll that has opened, which really provides some opening questions just for us to understand who is really listening on this webinar. So again, questions. You have about 30 minutes to send it and to get them answered. And Mohammed, I'm going to take the first question that we have received, and really I would like to ask you, colleagues listening in the field have sent the question to say, based on your experience, what would you say are the top tips, the top actions that a humanitarian country team, and you were really the focal point in Central African Republic, should take? Ambassador Swing spoke a minute ago about the field guidelines that are about to come out. Also, it will be further discussed during the Humanitarian Coordinators annual retreat that will take place in Montreux at the end of May. But in the meantime, it would be really very helpful if you can give us your top tips, your top advice, the top steps that any of our colleagues listening around the world should take in order to ensure that PSEA is followed. You talked earlier on about preventing, responding, and coordinating. It would be great to hear your views on the steps to be taken.
Thank you, Panos. I think there are several steps, but if I have to maybe summarize them into few, I would just say, as the ambassador said, policy, guideline, SOPs, procedures that make the whole system and the whole humanitarian community to work as a one, using policy which are enforced on a daily basis. That's one thing which I find very crucial. The second, I see, for example, everything that is related to the system of alert and to the system of prevention. Because what the experience also has shown that some of this abuse or exploitation are perpetrated and brought to the attention of the international community maybe 1, 2, 3 years after, to make even sometimes the response more complicated. I think now that we are aware of the importance of this situation, we are aware of its scale, we have to put a lot of focus and a lot of attention on what is the mechanism we have, not only to prevent, but in a case it occurs, that we are aware of, and we are aware of early enough to be able to provide the appropriate response. I would see also coordination, because also there are so many actors involved. In the context of CAR, we mentioned humanitarian workers, we mentioned peacekeepers, we mentioned civil servants that are not under uniform. We are not saying that it's taking place with all these groups, but the potential is there. And if we don't coordinate our activities across the board, within the UN, within the mission, the peacekeeping operation, within the humanitarian community at large, within the international partner and the national partner, we are going also to face a challenge, and I think coordination is something which is extremely critical. Now, I will say also that this is part of the an issue sometimes which we can analyze, or we say often that what we are seeing involving international forces or peacekeepers could be only the tip of the iceberg, because most of these SEA are occurring also in a context where you have a broader picture of violence against children, violence against women. We cannot address this issue by only remaining at the tip of the iceberg. We have to look at also programmatic framework. We have to look at also structural dimension of this phenomenon. We have to also set policy, program, and intervention that can address the underlying and the root causes to be able to have a solution which go on the long run. Though we acknowledge that the principle and the pressure and the urgency now is to stop what is coming from the international forces who was supposed to come and protect these civilians and turn against and abuse them or exploit them. That's the urgency, but we should always keep in mind the longer term perspective, the structural dimension of it, and put the SEA response into the broad context of the agenda of protection of children, protection of women, and human rights in general.
Thank you, Mohammed. Really very helpful to hear your field perspective. I've been taking notes as you speak, and I see there is 8 points you made or are presented. So I'd like to ask actually on the visual also to follow the 8 points, which I'll summarize very quickly. I see you talked about the PSEA architecture, basically the leadership, the coordination, the task force on the ground. You talked about the strategy, which is really the code of conduct, having every single humanitarian worker sign a code of conduct that goes to their own agency, having the SOPs in terms of mapping the assistance. Thirdly, you talked about the action plan, basically what the action plan that needs to be put in place, the monitoring, the financial, technical resources. Fourthly, you talked about the raising awareness. I guess this goes with the code of conduct. You also talked about the response mechanism in the community itself, the leadership within accountability, the media management, and having a dedicated person, particularly if possible in the team, to be able to take it forward. And I think yourself taking the leadership within the HCT, being a focal point with other colleagues to bring it forward is really crucial. For colleagues listening, we'll be trying also to summarize this action points in the webinar summary that we'll be sending to everybody so that you have the practical steps. And I'm sure when the guidance comes out with the field guidelines would first shed further light to that. I'm now going to take us to Ambassador Swing. And Ambassador Swing, what you said have prompted quite a reaction from listeners. Many of the listeners have reacted to what you said about staff who have been abusers, who have being rehired by another organization. And this is really quite a crucial one. I also understand that the task force has really submitted some recommendations to the agency principals, the IASC principals, in order to improve the recruitment and basically in order to make sure that abusers are not rehired. This is really unacceptable. So I have multiple questions to say, any progress on that? How really can we make sure within the community, the UN and the NGOs, that people who have been themselves perpetrators are not rehired by other organizations? Ambassador. Colleagues, we have a technical sound problem we're trying to sort out.
Okay, sorry, now I'll just go. Okay, I'll go back over some of these points again. As I mentioned, this has been discussed by the IASC task team on next steps. But unfortunately, there's been virtually no movement on this in the past 2 years. But we are reviewing it now, and it clearly needs to be a system put in place that will prevent this egregious recurrence of people coming back into the system who have been dismissed. I think that's the least we can expect. I might also say, and I want particularly to thank our colleague and friend Mohammed Fall for the good program that he's outlined. I think it's excellent. I hope we can all follow it.
We are working on several tools that we hope will be of assistance to you. One is we will, IOM within the IASC, will be coordinating a guide from the community-based complaint mechanisms, best practices, some operational tips for interagency PSEA complaint mechanisms. We hope that that can be sent to the IASC principals for endorsement very soon, after which it would be circulated widely, and we would try at IOM to coordinate and keep it regularly up to date. Second thing has been referred to already, global standard operating procedures. We have been requested to lead a task team of agency experts to develop these standards on cooperation. We're working currently with 15 agencies, 9 of these UN agencies, 5 NGOs, plus IOM, to develop these global SOPs, aimed to fill a major gap in our PSC practices. And the third one would be a common reporting platform on SEA prevention and response. We hope that we would have that as an online monitoring and evaluation tool fairly soon. But let me leave it at that for the moment.
Thank you, Ambassador Swing. I'm going to take us back to CAR, and Mohammed, there is a colleague, actually a couple of colleagues who have come back to this 8-point question, and I want to let you all know that we will be sharing the PowerPoint and a summary of this webinar. So a caller says, you know, can you just tell us practically, I mean, there is a policy, but practically, how do you bring it in action? You talked about these 3 levels, the 8 points. Can you elaborate a little bit further? Like, let's say a case comes to surface. What would you do at the agency level, at the collective level? How would the case move step by step? If you can guide us through that to inspire colleagues listening elsewhere to be able to put in place.
Thank you, Panos. I think, yes, case management is one of the most important components on our work on SEA. It has several folds. Maybe I will go through them, some of them, or the most important part of it. I think one of the first aspects to work on if a case comes to surface or come to our knowledge is first of all to alert the system at large. Usually we alert the special representative of the Secretary General, who is the senior UN staff in country and who has the leadership of the mission, if it involves a peacekeeper or someone in uniform. And we do also inform the leadership of the organization if it is a humanitarian worker staff that is involved. Alerting and making the situation known is the first action. And I think now with the commitment and the drive we have seen at the international community level, we see this alert system being developed across the board. I can say that, for example, with UNICEF, we have an SOP of reporting any incidents that come to surface, with the specific timeline, with the specific channel involving regional office, involving headquarters and senior management at the highest level. I would say also that immediately the tasks are divided. The first part, which is the victim-centered approach, is which kind of response, which kind of support and assistance to be provided to the victims. And that goes through the kind of step that I have described earlier, which is referral to medical structure, which is psychosocial support, which is all the support around the reintegration or the protection of the victim. Whether it is a child, if it is a child, it's usually UNICEF, the mandated organization to protect children, is the one that step in and take over the responsibility of providing the assistance. If it is adult, it is UNFPA or other partners who are involved in gender-based violence or gender-based management. Now, you have also the other part, which is we have been extremely happy about, which is the quick way now the peacekeeping mission the leadership of the Humanitarian Organization Act. Most of the time, any alert will trigger an investigation. Whether the facts are substantiated or not, we go through an investigation process that helps it. But it happened that sometimes for the peacekeepers or the troops that are on blue helmet, getting the member states to send an investigator or getting the investigation to start being rolled out can take few days or can take time. But what we have witnessed in a recent period also is UN has deployed investigators through its Office of Investigation and Oversight, and those investigators have MOU with troop contributing countries, and that MOU allow them to trigger the interview and the substantiation process, based on which information could be also shared with the investigator of the member state for the judiciary action to be taken on these issues. Now, in this part also, we do intervene as a humanitarian community and as a humanitarian organization. Because as I said earlier, the protection mandate we have is very broad. It goes to the response, it goes to the support provided to the victims, but it goes also to the assistance given to the victim during the interviewing process. Because most of these investigators could be people in uniform, they could be from the army of the given country judiciary system, and getting them in front, or getting a child in front of this investigator could raise a certain number of issues of comfort, of disturbing questions, of length of interview, of many things that could destabilize or that could also further traumatize the victims. And for that reason, we are always providing support through partners or through staff who are specialized to be able to attend those processes to make sure that everything that are conducted goes according to standards and goes according to norms that we are working on. I want to highlight also important things, important initiatives that I have witnessed within UNICEF. It's the collaboration in a vertical level. I have in my years of professional experience in UN, I have few times witnessed a kind of commitment as we have seen in a recent period. Like, for example, for UNICEF, this is the question that is taken at a very highest level in a very important way, both at headquarters, regional office. We have weekly call, we have constant mobilization. We almost mobilize our organization across the board to make sure that all resources that the country office needs are made available to make sure that the response are provided and on a timely fashion. Maybe I will stop there. I don't know if there will be more questions to allow me to come back on some of the aspects that I have raised.
Thank you, Mohammed. Definitely there's more questions. I welcome lots of questions we have received from colleagues. There is about 15 minutes or less left to the end of this webinar. I will be asking the speakers to be as brief as they can in the answers so I can take as many questions as possible. Mohammed, you mentioned the question of the agency responsibility and the role of leadership and what you call the vertical collaboration with the UNICEF, but also at all levels. And I'd like actually to take the question to Ambassador Swing. A caller has written a question to Ambassador Swing. You spoke earlier on about the role of leadership, or rather the lack of leadership that you see, and the need to fill this vacuum with a stronger leadership at all levels. So what more needs to take place in order to ensure proper leadership and really a top-down and a bottom-up approach to addressing this case? What action should be taken more in order to enforce, to enhance, to make sure that as a humanitarian community at all levels, we really are doing the right thing?
There has to be a commitment at the highest level by the agency head. If we don't have that, we're not likely to accomplish very much. We have to have systems in place, including the complaint mechanism. We have to have it in the terms of reference, in the staff evaluation system. It has to be evaluated at regular levels. There are a lot of other things that are not being done. I thought for a long time, for example, that there should be some kind of pre-departure training and orientation of the battalions and brigades coming into a country before they get there. In other words, if you can't sign up to this before you leave, then you shouldn't go. I think we need to be much firmer with those who do commit violations. We haven't done that. I think I'd say a word also just generally about agency accountability. Agencies need to have a mechanism whereby they know that those who are abused can have access to justice. There should be an agency accountability system. One question was raised in this regard as to what happens if one agency has a much higher level than others of cases. Sometimes the higher numbers simply indicate that they have a very effective complaints mechanism. Also, the real question is whether they're actually addressing these cases. And then we have to have regular PSEA training for staff. It needs to be repeated at regular intervals because staff change. And we need to share case numbers, other case information within the humanitarian community so that we can identify trends and we can begin to develop some targeted interventions. There are many other things to be said, but I'll keep it short. Thank you.
Thank you, Ambassador Swing. If I can follow up to this, again, one of the callers is asking about whether you've seen any cultural shifts within the system in order to be able to address PSEA. Is it still a difficult topic, or are we a lot more open now to talk about it and, most importantly, take the necessary action to be able to address it?
No, I think we've clearly seen some progress. This is why we're here today. The fact that we're holding this webinar indicates that we are trying to get out word about what we've been able to do in terms of standard operating procedures, in terms of guides that we can give the field. I think the fact that we're reviewing it today is itself indication of progress. However, if you look at the progress we've made since 2011, at the beginning we had 25 senior focal points. We had action plans in 25 agencies. We had a regular review in our twice or three times yearly get-togethers on the issue. Unfortunately, in the past year, this has dropped off to 14 agencies with senior focal points. So we've made progress, but then we have also retrogressed, and this, I think, has to be addressed. And I will bring it up when we meet in Montreux with the Humanitarian Coordinators, and I will certainly bring it up at the meeting on the 7th of June in Washington of the Interagency Standing Committee, where the World Humanitarian Summit will be reviewed, but we will also review PSEA at that time, and I will express my concern that we're beginning to show some sort of receding commitments on the part of some of our agencies, and we need to augment that.
Thank you, Ambassador Swing. And it's, I understand there's also a side event on the summit where PSEA is also being discussed. Really an important part of our humanitarian work. Mohammed, I have a question for you. One of our colleagues listening has sent a question and says, can you give us an idea of what budget is needed for PSEA? You talked about also having some money on the side. What is the monitoring, the victim support, the awareness? What are we talking about? This is a huge issue, hugely important to be allocated appropriate resources. Can you give us a little bit of an idea how you went about it in Central African Republic?
Thanks, Panos, for raising this important question, because we have spoken at length about the response and the victim-centered approach. And I think one of the first requirement for this component of our intervention is the resources you need. For the time being, it is very difficult to come with an exact cost, but when we have seen the issue or the number of cases raising significantly, yes, within UNICEF, we have discussed this from our executive director to the country office to see what additional resources can be mobilized to be able to bring the appropriate response that is expecting for the victims. And today, I would say that really I'm very proud and happy of the steps and initiative taken by our senior management. I think Tony mentioned in a recent meeting in New York that he has released like $1.8 million to UNICEF country office just to help us to be able to respond to this large number of cases we are witnessing. And he has also mentioned this was something like 10% of the global or the total set aside amount that UNICEF has corresponding to this kind of emergency or emerging issues. I want to say that this is work also that requires and which is very staff intensive because the monitoring, the management of the case, the engagement to support the victims and the survivor, the contracting procedure for having NGO or partner to be providing all these different fold of support that I have mentioned earlier require also a huge amount of resources and a huge amount of money. We do have also a lot of spending or resources required for everything related to prevention, mainly prevention from the side of the potential victims, raising awareness, doing communication campaign, informing potential or possible victims on the mechanism of complaint that Ambassador Swing was talking about, raising awareness about possible risk of those involved on sexual exploitation. All of this also required an intensive work. That managing also the cases required setting up a database to have each individual cases coded, followed up to make sure that every intervention that has been taken from the day we hear the complaint to the day we are continuing the support, both medical, from medical perspective, from psychosocial, relocation, community reintegration, school reintegration, all of these things have resources, and having a database that helps us to trace all these steps also require an important resources. And I think also within the UN system at global level, we have seen that now there is a proposal that was put on the table which is being worked out, and I'm sure that soon results will come. It is this issue of setting up a trust fund in which, for example, we will provide or which could be providing resources to victims. And I think that's also something that is very important and that shows that the issue of resources should not be forgotten into this conversation because it is the most important part. Of course, there are other resources that are required, for example, in the investigation process, that are resources that are required, for example, in the trialing process. There are support that are resources that are needed or that are required, for example, for all the investigation process that member state takes into account, or then the UN throughout OIS is deploying today in CAR. And I think we haven't come out with an exact or a specific idea of the costing, but it was extremely important and it was extremely good that one participant raised the issue of resources because it is really an important issue, but I see that it's being addressed both within individual organizations but in the system at large.
Thank you, Mohammed. The commitment of the agencies, the excellent example of UNICEF, the other agencies, all agencies really to be able to allocate the financial resources, to give importance, to give the support that is required to this really very sensitive but also very important question. Colleagues, we have time for just one last question, and I'd really like to take it to Ambassador Swing. Ambassador, we received a question from one of our colleagues listening who is bringing another dimension, which is really how do we manage the media when a case happens at the country level, and I'm sure from your time in Congo, but also in multiple field assignments, there is always a nervosity about how to go about it in a way that is transparent, but yet doesn't give a bad reputation to all of us. What are your reflections and advice?
No, I think the media has a major role to play in helping us to stop PSEA. I think, first of all, we do have to be, I think, totally transparent with the media. I think it's much more important if we come forward early on with the media rather than waiting until they discover what's gone wrong. We need to be in a position to show that due diligence has been done time and again. We've done everything possible to prevent it. We need to be able to talk intelligently about all the good steps that Mohammed Fall has just spoken about, the 8 points that were made to show that everything humanly possible has been done, knowing that probably there's always going to be someone out there who's going to cause a reputational risk and damage to beneficiaries. But we need to be seen as on top of this issue, open about it, and responding in the most urgent way possible. If we don't do that, then it will go against us much more so. But if we're upfront about it, I think we're in the strongest position possible. That would be my recommendation.
Right. Colleagues, I want to point out that there is a closing poll that you see on the right-hand screen of your computer screen. I would really like to urge you to take a minute to give us your feedback as to what you found the most useful about this webinar. In particular, since we are also repeating it live on Friday afternoon. I really want, first of all, to thank all of you who stayed throughout the webinar to the very end. I hope you found it useful. I hope the practical steps, the wisdom and advice that have been shared from our speakers will be helpful. It's helpful to all of you. I would like to repeat again that a recording, an audio recording of this webinar, but also a summary of the action points and the PowerPoint will be shared with all of you. I hope that would be helpful to be able to inspire you, to guide you, to take these practical steps, no matter where you're listening from. And I'm really welcome that we have colleagues from 59 countries listening to this conversation this morning, this afternoon if you're in Asia. I want to say really a warm thank you to our distinguished speakers. We're delighted and thrilled to have with us Ambassador William Lacy Swing, who is the Director General for the International Organization for Migration, IOM, but also he's the champion, the Interagency Standing Committee champion on the prevention of sexual exploitation. Ambassador Swing, really, we appreciate making the time and sharing your own very, very blunt and very thoughtful reflections on this very sensitive issue and being so outspoken to it. I also want to wholeheartedly welcome and thank Mr. Mohammed Fall, who is the UNICEF representative in the Central African Republic. He's also the humanitarian country team and focal point for the prevention of sexual exploitation and abuse, and has joined us live from Bangui. Mohammed, has been inspiring to hear your practical steps that you have put in place in Central African Republic to make sure that prevention and support and coordination takes place in a very open and transparent way. I think we all agree in order to move forward as a humanitarian community, whether we work for an NGO or from a UN agency or international organization, we need to be upfront, we need to be open, we need to be frank, and really to know exactly what needs to take place and to address it in a forward-looking way. So a big thank you from all of you listening, and wish you all a good day. This brings an end to this webinar.